So we are here at the 9th edition of the ARAR meeting, and things seems to be going well. We have improved number of participants, large presence for both online and on-site meetings. We gathered together a high number of esteemed international faculties, and I am very happy to say that most of the people talking at this meeting, they are the visionary and they are the leaders in regional anesthesia and chronic pain treatment in the world.
It's a fantastic congress, vibrant, with full of enthusiasm, passion, great scientific program, fantastic social events, and a truly family ambience.
The Congress has a very high scientific level. It is connected with ESRA and has recognized CME and CPD points.
I've been so impressed by the international and local faculty. The lecture content, the delivery has really been of the highest standard, and I think the organisers should be very proud of themselves bringing a conference of such high standard to Romania. Over the last several years I've seen dramatic improvements. It started off as a small conference with just a couple of international speakers, and now there's an extensive international faculty alongside Romanian experts bringing their expertise to the community.
I've been fortunately a regular speaker at this meeting, and what I can tell you is that it's highly professional. The scientific program is high quality, and the organization has been improving a lot since it started. It's been a real pleasure to be involved since the beginning. It's rewarding for me as a speaker.
It's fantastic to be back in Cluj for the 9th ARAR conference. I've been to this meeting now several times, and it's been so inspiring to see the development of the meeting itself in terms of the content and breadth of lectures, and really the very high standard indeed of education development and the workshops.
It's my 9th time, I think. I've been at all of the editions, and I have to say I'm really impressed as always with the excellent organization of the meeting. Excellent support from companies, excellent program, good participation of the attendees in the various sessions, great workshops.
This is actually my second visit to Romania, and as the last time, I'm very impressed by the organization. You had speakers from all over the world, and I know that all of them are very high caliber speakers.
Dan has recruited a fine line of speakers, international speakers from all over. I think the gathering of great minds from all the regions coming together to discuss and to learn the latest innovations, the latest advancement in regional anesthesia is definitely very appealing.
And it's a perfect combination between science and social events.
Well, I have to say it's my first time visiting from Switzerland to come to Cluj, and I'm really excited about this congress. I didn't expect such a high level of all the lectures I had the chance to attend.
This is my second time at one of the ARAR congresses. I think Dr. 𝐀𝐬𝐬 achieved an excellent performance with organizing these congresses, in the sense that now we have a congress specially designated to regional anesthesia, which is bringing more and more renowned experts from all over the world.
I'm very impressed with the congress, and I think it's run very professional, good lectures, nice arrangement, and nice industry support also.
I think it's a good opportunity for the young people to continue their practice and to expand this practice by using different technology in radiology or in ultrasounds.
You have the interaction between different practices in different countries. You have different speakers from Europe, so you can see the practice is different from Northern Europe to Southern Europe. You have people like myself from Africa, who is completely different from here, and you have people from the USA as well. So there is actually a lot of interaction between different continents, and this usually the interaction would bring new ideas and trying to make as safe as possible for the patients, of course.
Yes, it's always a good thing of networking and meeting the experts. Different countries use different techniques.
Congress is very incredible. because very important topic we talked about is pain medicine. As you know, in Ukraine is very difficult situation. We have a lot of patients with chronic pain, with phantom limb pain. It's topic very important in future too.
It's a chance to be here, and I like to thank to Dan and the organization to invite me. It will be so nice to have connections with the society from Turkey and Romania in the future, and we will organize something else together.
It's a perfect opportunity to make friends and networking. Really, the setup that Dan has come up with is excellent. So he arranged so much around for us that we have a lot of fun, and this really flattens the floor for interaction in a perfect way.
It brings a lot of new information on topics related to regional anesthesia and pain medicine. It brings the young generation closer to the pioneers in our specialty, and of course a lot of networking and discussions.
This is will find a way of contact and connection with other centers where they can find some procedure to be done outside their hospitals.
Lots of stuff is happening all the time. A lot of scientific evidence being presented. So this should benefit all clinicians all around Europe.
It's very important to all people, all anesthesiologists, to have connections and to have networks.
Especially for me, it's scientific things, because we receive new knowledge how to treat this chronic pain with different type of patients. It's a very interesting place for change knowledge for young doctor, because young doctor now treat a lot of patients with chronic pain.
Really the interaction between you and the individual doctor, but also between the doctors amongst themselves, and then you interact with them, makes it for the teacher better, but also for the attendees. And I think you really learn from each other. But of course, I also learn from the questions the younger doctors ask me what to focus on when I'm teaching.
It feels like it's, you know, that you can really ask questions. I've just done a workshop there, such amazing delegates. Everybody's coming, they're so eager to learn. They've got loads and loads of fantastic questions. Honestly, I can't recommend it highly enough.
I think that the networking part of this session is really important because it gives me new insight on my research, my daily practice, and it can only make the care of our patients better.
It's probably the best way for the younger people to be together with the older ones. It's a fantastic idea. It gives to the young people opportunities to express themselves and showcase where the pathway in our specialties should be.
But also the development in Romanian anesthesia. It's clear that it's of a very high standard, with professionals who are seeking to deliver excellence in patient care.
If you look at all the different things that are on the programme, you're not just looking at regional anaesthesia, you're looking at obstetric anaesthesia, you're looking at chronic pain, and of course my favourite, point of care ultrasound. So it's really important at congresses like this that we don't just focus in on one area, because the patient, we'd have to take them as a whole. So there's everything here from basic science to artificial intelligence to what is new and cutting edge right now.
It's a field always developing. Every year appear new blocks, new techniques, new drugs, and we are taking care to have them all here at the ARAR meeting.
I think it's the first time in Cluj that we can present something like that. We do a very new kind of simulation, so it's not only crisis management training, but it's much more just daily cases, daily tricky cases. We try to really stimulate all senses of our students and hopefully make the learning progress a lot easier by just seeing and doing instead of just sitting there and listening to a lecture.
We discuss a lot of interesting things. We have also the simulation sessions that are a topic that is very important for me, because we have the opportunity to simulate in real scenarios.
For me, it's an amazing chance to network with all the giants of regional anesthesia and participate as a part of a group in simulation.
There are many speakers here who are internationally known, and they have the opportunity to talk to them face to face and talk about various techniques. So this is not something you can learn from reading a book. You have to go to a conference.
I think they're very, very high quality speakers. You have the presidents of the European societies all over Europe.
Every year I see more and more renowned speakers. They are truly some of the gurus of the regional anesthesia from all over the world who came to Cluj and in that sense raised the standards of this Congress, and for this reason the organizers need to be congratulated.
So when you get these speakers from all over the world in Cluj, you have the chance for the young Romanian doctors to come and have the experience of experienced doctors from all over the world.
I realized that the faculty that are invited, they are super friendly and approachable, and I think it's a great opportunity for trainee doctors to come because they can actually learn from the mentors.
It's important for the younger generation to deal directly with the experts, as in some of the peripheral hospitals they might not be able to learn the absolute finesse of these techniques in relation to their everyday clinical practice.
Dan has set up the most amazing number of speakers, but what I really like about this meeting as well is that you've got loads of local faculty as well, and that's really, really important because there's obviously so much regional anesthesia, chronic pain, obstetric expertise right here in Romania and surrounding countries. So it's great to have that mix of both.
We had an excellent speakers from Romania and outside Romania, and all they have good experience in different domains in anesthesia and pain management.
Definitely, the speakers are very approachable and you can ask them anything. One of the sessions that was chaired just now was very interactive with a poll, questions and answers, and the question box is always full with questions, and there's lots of time for discussions, even during the tea breaks as well.
The level of the speakers is excellent. They have up-to-date knowledge presented during their lectures. There is a lot of enthusiasm during the workshops, during the simulation sessions. It is great. It is fantastic.
The hybrid version of the Congress definitely has some challenges. We like human interaction. We like to be together. We'd like to hands-on, you know. We are doing a lot of workshops. And then you will ask yourself why we are doing it if we hate it. Because remember, this is a congress and a joint congress between the Belgian society, the Romanian society and the Ukrainian society. And unfortunately, due to the problems that we are all aware about, the Ukrainian colleagues, they cannot leave their hospitals because they need to take care of the flood of patients that are coming in. So for them, we are transmitting online to be sure that the most current knowledge gets to them, and they will be able to use it in the help of their patients. But we are eager and can't wait to the war to be over and to have them here on site with us and to stop the online transmission.
One of the things that I think has been really outstanding has been the engagement from all of the delegates, the time for discussion at the end of every lecture, where people can really have a meaningful discourse about the topical areas of our specialty. And I hope that this has been inspiring for the next generation of anesthesiologists in Romania.
So I'm overall extremely positive, and I also see that the meeting grows both in size as in quality over the last years. So I have to say, when 10 years ago we started with the meeting, and now the meeting is completely different in terms that it has significantly improved. This is a conference where you will see all aspects of regional anesthesia. You have hands-on sessions to train as well. And I think that's the most important thing, don't be shy, speak up, ask questions, because you can really ask the questions to the real experts out there, because all the experts here are also clinically practicing anesthesiologists, so they really do the stuff what they're talking about. And that's, I think, an important message.
Please don't be shy. Ask questions, be together. It's very important to meet people in their working points and learn.
Improve your education every day, because it's medicine is now a challenge, really challenge. Every day changes.
If you want to learn something quickly and very efficiently without reading a book, come to this Congress.
Definitely they should come. It's a great opportunity. It's not only a national Congress, I would dare to say it's international conference with a lot of experts outside Romania being fully ready and willing to explain, to answer, to transfer the knowledge, to showcase that there are no barriers in knowledge spread, that there are no boundaries.
So guys, you've got to come to this Congress. You're going to meet the absolute experts in everything. You're going to be able to sit and talk to them, to ask those questions. You're going to be able to do workshops with us. You can ask everything whatsoever. So just come and learn. It's so entertaining.
So now that the ARAR 2025 is over, we will start to prepare the next edition, and it is an anniversary one. ARAR has 10 years of existence, and we are preparing the 10th edition of the ARAR meeting, and I promise you it will be something that you've never seen.